Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. All right, Tim, tell me what's going on with your foot. What happened?
Originally,
Mm-hmm.
pain started to occur about anywhere from about 10 years ago. Skateboarding is
Okay.
what all my injuries are from mostly.
Okay. Mm-hmm.
And I would originally skateboard and have a good time skateboarding, and I get off my skateboard and walk around and realize that my Achilles or something hurts back here.
Okay.
Even though I just had a great skateboarding
For
session
10 years, yeah.
and I never fell. And that was around 5 to 10 years ago I would realize that.
Mm-hmm.
But a night's rest or even just a couple hours of rest and some ice, and then I'd be cured. And the next morning I'd be fine.
Okay.
Then about
Are you
somewhere
doing his leg?
about
Make sure. Okay.
about 5 years ago, I was a golf caddy for 7 years,
Okay.
and I realized I had plantar fasciitis for a little while, and
Okay.
then that's what made me realize I gotta stop wearing bad footwear,
Okay.
skateboard shoes and stuff when I'm working on the golf course, and wear good
Oh,
footwear.
wow. Oh, okay.
So I started doing that then,
Mm-hmm.
and then about a year ago,
Okay.
last summer or last spring,
Mm-hmm.
I was golfing
Mm-hmm.
and got home from golf. At the round, I realized that at the end of the round, my heel started to hurt. I'm like, what's wrong with my heel?
So you're healed too? Okay.
Then I get home, take my shoes off, everything off, and I realized that's when I finally realized that the bump was there.
Okay, so we can see the bone spur, and we're gonna show it to you like from other view when he stands. Like you can see the bone sticking out. That's a bone spur, closer to his Achilles tendon here, and his pain where he has his Achilles tendons attached. So it's he has Achilles tendonitis, and he had plantar fasciitis and bone spur. Okay.
Yeah, and you'll be easily able to see it when it's compared to the
Yeah,
other
when
foot.
when you have your stand up, it's very obvious. To see.
But yeah, so this bump started about a year ago,
Okay.
almost a year, and then it's just gotten progressively worse ever since.
So for all this time, what kind of treatment you had?
I went to insurance with Kaiser Permanente
Mm-hmm.
and had corporeal shockwave therapy.
Shockwave therapy. Okay, what else? Did you have anything? Physical therapy?
Other than me,
massage,
just like me, just looking on the internet and looking
doing
at
exercises.
and just doing
stuff too?
exercises I'd find on
Okay.
the internet and stretches and stuff like that, and then icing it,
Mm-hmm.
and yeah, that's pretty much it.
So, how much pain from 0 to 10, and how you describe it at worst?
It's chronic because I'm an avid surfer and skateboarder,
Okay.
or surfing and golfing. I don't skateboard much anymore because that's where all my injuries are from. But still very active, walk everywhere I want to. And so it's a chronic pain that
So you have
annoys
constant pain?
the heck out of me.
How
Yeah.
much for the
So
constant pain from 0 to 10?
it's at least a 1,
Okay, that's
and then-
constant pain. Okay.
and it goes up anywhere to 5 or 6.
Okay. So what kind of motion aggravated?
Just
Standing,
using it all.
sitting, stretching.
The
or something?
skateboarding motion
Okay.
of this would be my back leg in skateboarding, so it's my
Okay.
pumping leg.
Okay.
So that's how it originated, or that's when
Okay.
I would do that, and that's how I would realize
Okay.
something hurts back there. And then just normal wear and tear, which is just a
Okay.
normal day of surfing and skateboarding.
Sure.
And I'll be tired by the end of the day, and I can't wait to get home to be able to ice my foot.
Okay.
And,
And you also said like you have also a morning pain, like you feel like stiffness and morning pain.
Yeah.
You need to first when you take steps in the morning or long sitting.
it definitely like warms up. Yeah.
Warms
So
up.
if sometimes
Mm-hmm.
just using it and like pushing past the initial
Yeah.
pain, and then like it'll get better throughout the day. And then if I put some good footwear on and like make it stable and like wrap it up big time, then I can go play golf sometimes and have a good time. But then some days there's bad days.
How you describe your pain? Is it sharp, dull, aching, or stabbing?
Sometimes it's very sharp,
Sharp in Achilles area,
Yeah.
Achilles tendon. Okay.
but not constant sharp yet.
Okay.
But I'm
And
sure.
for the foot here.
Nothing really here. That's why. But recently it has been stretching down to be underneath my heel and then to be right in the center. And this is just.
And that's especially when you wake up in the morning on the heel.
This just started to occur, in the last 48 hours, like this week, very recently.
So it's more symptoms like Achilles tendonitis. He definitely have bone spur there, and he get like some symptoms of the plantar fasciitis. So everything should be pain-free except before the treatment. We're gonna do the motion that actually aggravated, so we can use that for reassessment, okay?
Cool.
So I will have you come outside and we're gonna do some of those motions that really increase your pain level. And I want you to let me know how much pain and where do you feel it. So we'll have him walk a little bit. Excuse me. How's the walking?
It's alright. It's just right here in the center.
Okay, how much from 0 to 10?
Still 1 or 2 right now. Not much, but just I know the more I do it, especially with no footwear on right now, it won't take long for it to get worse.
So let's do like heel raises. You can hold on the wall and just do heel raises, and tell me how that feel. And single heel raise, heel raise. Sorry.
Do the other way.
Like yeah, on one.
Yeah.
How is that? 0 to 10.
It's okay. It's only like a 1 or 2.
Okay. Let's do the stretch that aggravated.
Like I've been taking care of it today so far during the day. It's that skateboarding motion really. Kind of like just a runner stance. So my lead foot on my skateboard and I'm pumping like that. And
actually, I will have
like
you
that.
face that wall. Can you do
right
that?
There.
Face
this one?
No, the wall straight.
Okay.
And do the. Can you guys? Can you see this? Look at the bonus spur. Let's
Yeah.
stop here. Can you stop?
Yeah.
You can see the bone spur here compared to the other side. It's totally sticking out here. He has really this very inflamed area and have a really big bone spur. Very obvious to see. So how much is now from 0 to 10?
It's getting up there now. It's 4, 5.
Okay.
It's just it.
Let's do. How many times did you do it now? Because we're gonna do count afterward.
Probably up to 20 now.
20 now? Okay, so that's our baseline. We're gonna do 20. And you felt it there, yeah?
Yeah.
Let's have you walk after.
It's just all.
And you can see the inflammation actually. It's the redness, the sign of inflammation swelling. You can see all it's red here. So let's have you walk now and see how that feel. Is it increasing now or it's okay?
It's okay.
Okay.
I know, it's just I haven't done much today. I've been taking care of it today.
So
I iced it a lot before I came here.
the more you rest, it feel a little bit better. But when you do activity, it just aggravated.
And I want to continue golfing and surfing.
Okay.
That's why I live in Southern
So
California.
we're gonna do those motions again. Okay. So we'll have you lie. Any other motion that aggravated, or just those two?
Yeah, just that right now, really. Or else the heel drops, I think so. If I'm on a step and trying to step up the step, you know, I think that
like
can really.
when you like on the stairs or something like that.
Yeah, just the calf. Yeah, it's just when I'm stepping up a step. Yeah.
Okay.
And you use that.
So let's have you lie on your stomach, and then we'll work on it. Make sure everything is. Both of legs. You have bruises here, so make sure you get like most of the body, like a big shot, so we can crop it later. Does that make sense? Yeah. And include me like the whole thing, just to the table or something like that. Like. Okay. Okay. So make sure you let me know if you feel pain, okay?
Alright.
So you feel this knot here?
Yeah.
Okay,
When you
guys,
tie them.
yeah, you see my hand, it's kind of rolling over something here, and that's a scar tissue. So our muscle should act like a rubber band. When you contract and relax, it stretch like this. When you have a scar tissue, it's like you have a knot in a rubber band. So when the muscle contract, it does not stretch much. That's why when you feel more pain when you do more stretch. Because you don't have that range of motion. That's scar tissue in the way. You had a lot of injury. I will have you go over other history of your knee, your cast, and stuff like that. Can you go over that while I'm working on it? What happened to your left knee?
Tore my ACL, my LCL, my MCL, and the meniscus. Because skateboarding once again, freshman year in college.
I'm sure that's not painful what I'm doing, okay?
Yeah, it's just no, it's not.
Okay.
It's a tiny little pinch, but saw 2 different doctors in 2 different cities because I was in college and then back home for Thanksgiving. Both doctor said go on crutches for 2 weeks. I walked around for 9 months with a torn ACL.
Oh, okay.
Until college ended and summertime came, I finally got surgery.
Oh, okay.
So that's kind of.
So ACL reconstruction, yeah.
Yeah, everything in that knee.
Other ligaments, or just ACL?
ACL, LCL, MCL.
Oh wow.
And
Okay.
the meniscus.
Okay,
Yeah.
that was in the left.
Yeah, left
We are
knee.
working on the right.
The other
Okay.
side. Yeah.
Okay.
A little back injury, also skateboarding, probably like 2012 or 2013.
Okay, we are in 2020. Okay.
Like almost.
COVID.
Yeah.
Obvious.
Somewhere to
Okay.
5 to 8 years ago.
Yeah.
Where I compressed the bottom of my spine. And then since this foot thing, it's just been my hip, right hip, which is the same as the side of the foot.
Okay. Do you still have issue there, or are you okay?
Yeah, no, that hurts every now and then.
So the hip and back.
I've taken a break from working out
Okay.
lately, and that pain has gone away a lot
Okay.
since because I've taken a break from
But
working
here's
out.
the thing. Well, it's good to take a break and so your body heal. But if that break for 1 to 2 weeks and you're still in pain, that's not something minor. You know what I mean?
Yeah.
And if the break does not really make any change, I think it's a better idea to check what's going on, because the goal is okay. You take a break, but you wanna get back to your normal
Yeah, I do.
life.
Yeah, and the break has been 3 months,
So it's
not
like
2 weeks.
it's not like quality of life. Just
Yeah.
But I don't recommend if you have issue to push it.
Yeah.
Because that will make it worse.
Yeah, no, I agree. And then after just a long day of surfing and golfing, the entire right leg hurts and the foot.
The whole thing.
The calf will hurt some days.
Yeah. So
Other-
your gait is deviated a little bit. I will give you some feedback about how to walk the right way. I will not be surprised to have more issue from your workout because you compensate for the issues here.
Yeah.
So you're gonna have more issues with. It's like when your car out of alignment, you will have more wear and tear with high mileage. The more you gonna do, because that's a risk factor. There's something wrong here that we need to release it. So today I will assume you are stuck purely in the proliferation stage in the healing cycle. So the healing cycle, the body has to go through 3 stages in order to heal. First stage is called inflammation. That's when the body starts to, like, for example, for external paper cut. During the inflammation stage, it starts to see swelling, redness, the blood starts to rush to that area. The second stage of healing is a proliferation stage. That's when the body starts to build the scar tissue. During this stage, there's a cascade of events happen, but I'm just going to go over the scar tissue for the sake of our time. So if our body does not build the scar tissue, it's open wound susceptible for infection. So actually scar tissue very essential for our survival. The last stage is the maturation stage where the body actually gets rid of the scar tissue by itself. That could take days, weeks, months, or years. As we get older, this process decreases significantly. So if your body does not really break the scar tissue and the tightness, you will not gonna go through the maturation stage, which means healing. So today we'll figure out if you purely stuck in the proliferation stage, or you're going back and forth between proliferation and inflammation. That's based on how you respond to the treatment. And I'm not gonna use the Magna Heal because that's what I use it as a tool to, as a diagnostic and treatment tool. So the Magna Heal helped to decrease the inflammation and speed up the healing process. You're gonna feel cold. I'm not gonna use it now because I want to know, is it purely proliferation issue or you have some inflammation? So you feel this bumpy area? Feel that?
Yeah.
That's a scar tissue. Roll this up a little bit. Okay, so you see this? Stuck here. So if you don't have a scar tissue, it should feel like nice and smooth like this. Feel that?
Yeah,
Okay.
there's no pain there.
So that's a scar tissue here. And your Achilles, your calf muscle attached from here, going all the way down here. So when you have a lot of scar tissue here, this part is not very stretchy, so when you push, when you stretch this part, you will just, the compensation is by the Achilles tendon. So you're gonna inflame the tendon to pull more
on the
to
calf muscle.
compensate. Yeah. And you probably have this for a very long time.
Yeah, I have. Yeah.
Why? And this is very good example to visualize. So his calf muscle does not stretch much. So what happened is it pull in his bone. So it keep irritating it. You start to have more inflammation here, more inflammation, swelling, inflammation, until you see that ball here compared to this. You can see it very obvious here, very obviously.
Yeah, so that bump is inflammation of the tendon?
Well, that's a bone spur. I can feel the bone. That's
a bone spur?
Okay, think about it this way.
Yeah.
When you wear very tight shoes, you start to have callus. That's when you're constantly rubbing against bone, you start to have inflammation in that area.
And the bones just
But for a very long time, that inflammation will turn to calcification, which is actually another form of scar tissue. So by definition, scar tissue is actually hardening of any tissue. It does not matter. You know, you feel the scar tissue here like bump because it's in the muscle area, but you're gonna feel it here because it's bone. You start to scarring in the bone.
Okay.
That's bone spur.
Yeah.
Spur. Does that make sense?
Yeah.
So a lot of people ask me this question.
The bone is just reacting to being irritated.
And inflamed, swelling. It's increased. The scar tissue, the tissue start increasing there. So you can actually visually see that swelling, the scar tissue that start to build on the bone. Because it's a bone, it's hard tissue. Because it's a muscle, it's a soft bump. Does that make sense? But both of them is actually the same source, the same process of the healing, inflammation, proliferation, maturation. It's just a different body part with a different tissue density. Does that make sense?
Yeah.
So one of the common question I get is, does ASTR treat bone spur? The answer is yes, we work on bone spur because that's a scar tissue. But it depends on how much inflammation and proliferation that will determine how long it's gonna take to work on those patients and relieve their pain. We might not find visual change because that takes time, but the goal is to make you function, you go back to your normal activity.
Skateboarding and
surfing.
If
you go back to normal and you still have that visual bump, and I don't care about the visual bump, you know, what I care about your function.
Yeah, I don't care.
That's fine.
I don't care either.
Yeah, we work on that, but we're not gonna totally get rid of it. Visually, you will not might see a huge difference. It's gonna take time because we have to do lab testing to see what element in your bone that is actually not helping to dissolve this. Because your bone consistent from calcium, magnesium, D, you get some zinc, you get protein. So if you have imbalance in your nutrition, that will cause the body building more scar tissue but not breaking it down. Is that painful or not?
No.
Okay. So I'm actually working on the Achilles tendon now.
It just kind of feels good.
Okay. And you hear that sound? Okay. But you feel all these knots here. And you can see after I finish the map of the scar tissue where he has redness. Hear that? Okay. So because he start with the, I don't know, you start with this pain or this pain?
On the back of the Achilles.
Yes.
Yeah.
But it's common actually, someone starts with Achilles tendonitis and they end up with Achilles tendonitis plus
fasciitis.
Plantar fasciitis.
Plus
bone spur. So it's kind of like a vicious cycle that, like a domino effect. One is failing down, the whole thing is gonna collapse.
And really, I already had plantar fasciitis when I was caddying.
Yeah, you feel that, like, you see the scars, you feel that kind of grinding here a little bit? Is it too much?
No.
Okay. So, yeah, we have to work on all of that at the same time. We cannot really pick and choose. Oh, work only in the plantar fasciitis. But we have to, because all of these actually, If you think about the healing cycle, all the diseases fall in that healing cycle, but we label the disease based on the body part. So Achilles tendonitis, it's inflammation in the Achilles tendon. It's inflammation back to the healing cycle. Plantar fasciitis, inflammation in the plantar part. So if you think about the healing cycle, it's one program, but we just gave it a different definition for the location of the body part. Oh yeah, rotator cuff issue or tendonitis or bursitis, it's inflammation in that area. Does that make sense? But a lot of the time it's mislabeled with itis, with inflammation, which actually most of the time it's proliferation. Proliferation in that area. Is that too much?
No.
Okay. Okay, so you're gonna dig a little bit, but make sure you tell me, okay? Is that too much?
No.
So you said you feel like you're walking on ice or like glass in the morning, the first few steps?
It feels like it's on fire.
Fire.
Or the other night when I got up in the middle of the night to go to the bathroom, and I took a step up one of the steps, and it felt like it was on fire, torching,
Okay.
fire, pain.
Okay, we'll have you walk. Tell me how that feel and do the stretching because that's what.
Yeah, I mean before it was just a tiny bit of a.
You have constant. You used to say like constant.
Yeah, it wasn't strong, but
pain.
it was a chronic one.
What about now?
I don't feel it at all.
Okay.
And
He's
yeah,
picking his leg a little bit better now.
for somebody who me is like extremely active and
Yeah.
needs my feet for
Yeah.
everything I do. Well, we all do.
Yeah.
But yeah, that chronic one makes a huge difference for that to be
Okay.
gone.
So we're gonna do 20 stretch, that's like kind of a stepping or stretching that you did before and you
Yeah.
said it's aggravate your symptoms. So we'll try to do the same number and let me know how you feel. You're gonna turn around.
Facing this way
Yeah,
or that way.
that
yeah.
way. So yeah, so we can see, you can see the both of Achilles. Try to get a full body. How is that? Any pain or it's gone?
It's there a tiny bit, but
0 to 10.
not as much as before. It just a half.
Half what? Half a one?
Half a one, yeah.
So it was like what? How much when we started? 5 or
It was
more?
more, yeah. It was like I said 4 or 5 or 6.
So it's a half. It's 0.5. Is that what you're saying?
Yeah,
Okay. So let's actually do one more thing.
yeah.
I'm gonna work. So I'm gonna use a Magna Heal now. Okay. So I use it as a diagnostic and treatment tool. So if you have a mild inflammation, with the Magna Heal should take like a few minutes
Okay.
to really get rid of it.
Wow.
Okay. So if 2 minutes is not enough, that's mean you have a little bit more moderate to severe inflammation. So we'll have you lie on your stomach.
Okay.
I'm gonna use the Magna Heal and we'll try it again because.
Motion. It was definitely a 5 or 6, going down to half a 1 or a 1. Right there.
Yeah, that's
Yeah.
not bad. Yeah.
Yeah, I think that's
Awesome.
amazing. Yeah.
Beautiful. So let's have you lie on your stomach. Okay. So I'm gonna use a magnet now to, because we can see a little bit inflammation there. Okay, and you felt it where? Here or here?
Right in the back.
The second time. Here?
Kinda.
Oh, okay.
Right where it's
Connected there.
Yeah.
Okay. We're gonna do the whole area here, so part of the treatment, because a lot of people ask this question, okay, you're doing the manual stuff, but no, ASTR treatment is a biopsychosocial model. The manual part is the part that I recorded in the video, but behind the scene, we do the entire biopsychosocial model, which include nutrition, gait training, posture, body mechanic, exercises, actually behavior modification related to the foot is actually the proper footwear. We'll go over the best orthotic based on the patient needs and the best shoes fitting for the patient. We'll go over what you should avoid in the future so you don't cause this issue to happen again. So part of the treatment is actually a lot of education to empower the patient to be self-dependent, not to know what not to do. So this way you really know, okay, if I wore this bad shoes, I know this is gonna be an issue.
Don't
Yeah.
skateboard.
No, well, it's not the safest sport, but what I'm saying, you know, we're gonna show you how to walk the right way. Because if you walk like with poor ergonomics, you know, it's like your car out of alignment, so you're gonna wear your tires because you walk like unevenly instead of your weight distributed even in both feet.
Yeah, actually, I think I kind of walk on the inside of my foot.
That's correct. You should land on your heel. So I'm gonna show you how to walk the right way because that's a risk factor. So for Achilles tendons, plantar fasciitis, the most common risk factors, well, anatomy. Some people like anatomically they actually susceptible to have this issue. Other people could be a combination of bad anatomy and bad shoes. And the third reason is the bad walking pattern. So so I like to address all of them. So when you feel better after the treatment, so we don't hopefully you don't have issue in the future. But that's part of the treatment. Okay, so let's drink more water. And we're gonna do the same motion again. How's that?
Feels good. Yeah. I
So no constant pain now?
feel just a tiny bit still, barely.
Where?
Just still same spot, really.
In that spot there.
Yeah.
From 0 to 10.
Definitely less than 1.
Less than 1.
Yeah, I mean just definitely.
Okay. And what about the
It just goes. It just kind of starts here. Just.
so you have a little bit inflammation. Let's do that motion that was aggravated. We're gonna do 20 now and tell me how that feels. I want you to suck your stomach in and do it. How's that?
I mean it feels good. Way
0
more
to
than
10?
like a 1.
Okay.
I think it's on.
Okay, we're gonna try something new on him. Okay.
Just a tell, but yeah, I mean it's way less than when I first came in here. You know,
So-
to me it's night and day.
Okay.
But yeah, if I have to answer honestly, yeah, I can just still barely feel it. You know.
So let's actually we're gonna try to use it's a new magnet. It's Magna Heel 2. We'll put it on it and wrap it, and I wanna see how you're doing. We're gonna do the same motion, and that's good. How's that?
Yeah, no, it feels good though. Yeah, I think it's kind of gone. Yeah.
Okay. So with the magnet, it's gone. That's mean it's an inflammation. The good news is when you feel relief with the magnet, that's typically take a few hours with the Magna Heel. Just leave it on.
And I'm just using it for a couple seconds here.
Yeah, you use it as needed.
Yeah.
Some patient has moderate to severe inflammation, have them sleep with it, walk with it. You know, you can do your daily activity with like sitting in front of a computer and watching TV.
Yeah.
You have it on, you're already having treatment while you're doing nothing. You know, but that's a sign of inflammation because that's what I actually used only for.
I can feel the warmth of it kind of.
You feel the warmness. Yeah, that's another thing that it's a sign like, well, it's a good that
It's just like a soothing feeling, which kind of feels warmish. Yeah.
Well, this is very strong magnet actually. It actually penetrates up to 3 inches deep. So that should, even if it's up high here, you're getting the magnetic treatment.
Yeah.
Yeah.
But yeah, it feels good because of the pain is a lot of time just right here too.
Right
so
here?
It feels good.
Yeah, so when you have
Put it
like
all
several spots of pain, you want to do it like for, doesn't matter, like 20 minutes here, 20 minutes there,
Yeah.
rotate it, and
Okay.
yeah, you will probably notice like some areas more inflamed than others, so that might need more exposure to the magnet.
Yeah, I'd probably have it here for a while, then switch it over to here.
Yeah, and put it on the heel and,
And then
sleep
even
with
put
it or
it-
something like
Even
that.
put it there for a while.
Yeah.
Yeah.
This is what I actually recommend, like my professional athletes, they take it with them in the game. You feel inflammation after the game, just put it on.
Right
Or
away.
if it's in your knee and it's not affecting your functions, just put it on while you're playing.
Yeah.
As long as there's no metal around, because this is a very strong magnet.
Okay. Wow. Cool.
Yeah. So what do you think about ASTR treatment? You just worked on it for a few minutes.
I mean, I think it's great. I think it's a better experience that I had at Kaiser Permanente.
Yeah. Awesome. Yeah. I'm glad you're feeling better.
No, I think, for me to be able to do this and not feel, before it was 5 or 6, and now it's less than 1.
Okay, that's awesome.
And I think says it all right there.
Yeah, awesome. Thank you so much.
Yeah, thank you, Dr. Jacobs.
Thank you. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.